WWT presents Experts.
Hello, everyone, and welcome to another episode of WWT Experts. I'm your host, Matthew Coble, as usual, and today I'm delighted to host not one, but two experts from Worldwide Technology in this episode of our four-part series about healthcare and how the industry approaches artificial intelligence, cloud, security, and today's topic, digital transformation. With me today are Dr. Sanaz Cordes and Jeff Morris. Dr. Cordes began her career as a physician and is now a chief healthcare advisor with Worldwide Technology. She consults regularly with healthcare and life sciences organizations, both mature ones and tech startups and everything in between, and she likes to help them make the most of the technologies that are driving the industry. Jeff Morris is a chief digital advisor with Worldwide Technology, and he works with our clients on digital strategy and experience design, primarily in healthcare, as he spent many years of his career leading urgent care organizations. Great to have them both here, doing two experts at a time, so thank you for coming. Great to see you.
And great to see you. Thank you.
Yeah, thanks for having us.
Yeah, good deal. All right, so Dr. Cordes, give us a rundown of the digital landscape in healthcare, right? So now that we're a few years removed from the COVID pandemic, I have to believe that healthcare organizations are kind of coming to grips with the dozens of point solutions that they justifiably deployed to meet all the needs that they needed during the pandemic, but now, they have to kind of sort through all of that, right?
Yeah, absolutely. And I think, your point about the point solutions is valid. We were really, struggling with things like telemedicine and how do we, connect with patients when they're remote and not just able to come into the office. But I think we're definitely seeing a shift now. Not that we're not investing in those sort of patient-facing solutions, but we are heavily, looking at and investing in things behind the scenes. So tools that are actually designed for the staff and for the clinician experience, which ultimately does lead to a better patient experience, but they're not, patient-facing and sparkly like when we were looking at digital front door and, some of these things. And I recently, was looking at the annual Gartner report where they interview healthcare CIOs, and I think it sort of aligns with what the market's saying because the survey showed that, they are really committed to implementing, AI, just general AI solutions, and then generative AI solutions, which can't, walk two steps without hearing that in healthcare right now, and cloud. So when we think about those priorities and the fact that when asked, where are their dollars going to go with their existing solutions, where is it going to go up, where is it going to go down, most of them expressed, that they want to reduce costs and legacy infrastructures, data center technologies, but increase investments in things like analytics and cybersecurity. So all that said, patient is still front and center, but putting tools in the hands of the physicians and staff is, I think where the focus is going to be.
Yeah. Jeff, is that what you're seeing too, or what's your take on that question?
Yeah, no, absolutely. I mean, I think there's a lot of the technological factors, but there's also a lot of economic factors. There was a lot of delayed care because of COVID, for example, that a lot of these healthcare systems are still trying to catch up on. They're working through a lot of the same things that a lot of industries are, with limited workforce, but still a lot of economic pressure. And then I always like to think of the famous Star Wars scene in the trash compactor, right?
Yes.
You got the centers of Medicare and Medicaid systems that are on one side kind of pushing, and then you've got consumers on the other side who are looking for decreases in pricing, kind of pushing on the other side, and a lot of these providers are caught in the middle. So there are a lot of economic factors in addition to the technology factors.
Yeah.
So.
Well, Jeff, that's good because I'm wearing the Han Solo and the Chewie socks today, so that totally fits in right there. All right, well, Jeff, with the prioritization of investments in artificial intelligence and analytics, as Sanaz talked with us about a little bit, what impact do you think that's going to have on the overall clinician experience, the employee experience in that healthcare environment?
Yeah, so it's interesting because, and Sanaz can attest to this, but clinicians are tech averse. They don't want to adopt new technology. There's just there's a lot of work that has to go into that, if you will.
Yeah.
And if it's not connected to the EHR, if it's not integrated, then they don't even want to look at it, basically. But what we're hearing from CTOs right now is that there's a lot of conversation from these tech-adverse clinicians around AI. And it makes sense to me because the promise of AI is that it's going to increase efficiencies, and that's what they're looking for. Given the pressures they've been through over the last several years, there's, the ability to kind of streamline their workflows would be beneficial to them, allow them to work at top of license, if you will. But there's a lot of other goodness that comes out of it. I mean, there's improved patient engagement through better communications. There's the personalization of healthcare, which is phenomenal. And then there's the clinical decision making that can through predictive analytics and a lot of the kind of support, if you will, diagnostic support from AI, they can make a lot better decisions along the way. And I think what really illustrates this, Dr. Cordes was telling me about a hackathon that we had recently, and I really think that illustrates what we're doing, don't you think?
Yeah, I mean, absolutely, I agree. And I think you're talking about so we did work with one of our partners, NVIDIA, and it was a hackathon code challenge. And so they asked us on the healthcare team to pick a challenge, right? What can we solve for? And most of you probably know that, pancreatic cancer is a terrible thing. It's diagnosed too late, has a 90% mortality rate. Like 70,000 people get it in the US a year. So anyway, we set up a proposal that let's take 3D CT scans and in 2 days, try to develop code that can identify these tumors way before a physician, a radiologist could. And I mean, these guys did it. I mean, obviously it's not ready to go and, have a user interface slapped on it, but just to know that, with AI, we can do something like that in
Absolutely.
2 days that we've spent, a century trying to figure out how to get ahead of is just, fascinating to me and amazing. So I think the clinician experience will be hugely impacted, your original question there, where it's really gonna allow them to do things that couldn't be done before, both by accelerating but also augmenting their reach to be able to just call all this information and create these great breakthroughs. But yeah, adoption will always remain a challenge, right? Making sure we get them over that trust hurdle.
Yeah, that hackathon with NVIDIA sounds super cool, and it's delightful to me that there's so many possibilities there with Gen AI in healthcare, right? And I'm glad we're a part of that. Well, so Dr. Cordes, you helped author a piece of research on WWT entitled "The New Healthcare Consumer: Leveraging Customer Experience Principles for Patient Engagement." And for those of you out there interested in that, you can check that out on WWT.com. But in that piece, you talk about the need for healthcare organizations to take a page from any number of enterprise organizations who are looking to improve their own employee and customer experience. And I imagine, there's probably something we should talk about from that in this conversation right now.
Yeah, I mean, we've got the expert in that topic.
We do.
Did you read that article, Jeff?
I read everything that you write.
Okay, well,
It makes me look smarter.
Okay, well, let's hear it. Yeah, what are your thoughts?
Good answer.
And I got to tell you, Matt, that she's very prolific, so that's a big job to read everything she writes. But really, the crux of the article was around the consumerization of healthcare. And when you think about today, the consumers have certain expectations, right? Like, I don't expect to be able to interact with a brand through a phone call or just a visit. There's a lot of other channels I want to use that I want to use that are on my terms. And so that omni-channel access is also critical for healthcare. That's why you see the rise of things like telehealth, for example. I want a frictionless experience. I don't want the nuisance of having to, look up my information in multiple places. I want to be able to find everything that I need in one place. And I also am looking for a personalization. I want to understand, I don't want to feel like a number to my provider overall. And so those kinds of expectations are really what's driving a lot of that with healthcare. So I think that this is where data and tools like AI can really shine, right? Is through the personalization of healthcare. That personalization allows us to create empathy. Empathy leads to trust. Trust leads to loyalty. I read an article recently, 91%, I know that sounds like a big number, but 91% of CIOs believe that trust is their biggest differentiating factor right now. But there's another side to the consumerization of healthcare. You want to talk a little bit about retail?
Yeah, I mean, I've been talking about this topic, with Matt and with you and on the platform for a couple of years. So I do just want to add that to that end, about the consumer experience, we saw all these new entrants to the healthcare space, Amazon, CVS, Walgreens, and they're still accelerating. They're still trying to, grab some market. But what we can do now is kind of step back and take a lesson learned from that, right? I mean, they were coming at it with like massive acquisitions of primary care practices and senior health solutions. Amazon bought One Medical, but fast forward now, a year later, especially coming off of the JP Morgan conference, we're hearing that things are slowing down, right? Like, we're not going to do as many acquisitions. We're going to try to grow strategically. We're going to cut costs in some of these primary care markets. I mean, I think what these organizations are seeing now is that healthcare is hard, but the ones that are successful and are likely, in my opinion, going to, continue to grab the market are, for example, Walmart, where they strategically are growing and in partnership with the traditional health system. So I'd say my big takeaway there, the message is you can't do it alone. The two sides really do need each other. If they work well together, then we can really do something spectacular. And patients do want convenience, quality, and at a good price, but they also want to be able to access all these additional things that the traditional systems can provide. And healthcare's hard, so you can't necessarily run it just as a business.
Yeah.
This episode is brought to you by Logitech. Logitech supports hybrid work with easy to set up and simple to use video collaboration solutions that are built for both the office and remote worker. Logitech harnesses the strength of key industry partnerships with Microsoft, Zoom, and Google.
Well, so the report we've been talking about also identifies data strategy and governance as important. So, Sanaz, can you touch on data in that scheme of all things, kind of AI and the digital investments we've been talking about? How's that affecting you?
Yeah, I mean, data is always the first step, right? I mean, technology is only as good as the data that it's fed. And I think especially with AI, now we're talking about training models on tons and tons of data. So regardless of what initiative an organization's taking on, we got to start with the data, access it. Is it accessible? Is it clean? Is it up to date? Is it complete? Who are the stakeholders that we want to put in place to govern it? So I do think data is getting a bit of the spotlight now. It was, it was always something that was done, but it wasn't like, hey, I can't wait to get up and, jump on that data governance. Yeah. But now, I mean, it's what our customers want to talk about. So, I don't know if
and I would double click on that. I mean, I think that there's, healthcare is one of those industries where data resides in a lot of different silos. And so bringing all of that together is a big task, but really the principles remain the same. You've got to develop, like you said, you've got to develop a data strategy. You've got to look at the quality of that data, understand how clean it is. Where is it coming from? Where are the integrations that need to occur for all of that data to come together overall? And, really kind of understanding the governance aspects of it. I mean, security alone, for example, I cannot emphasize that enough. I mean, healthcare is in the top 3 industries that are being targeted by cyber attacks right now. And, they're probably one of the most vulnerable overall.
Yeah, and I think we'll probably hear more about that in another of the 4 episodes in the series as well, because that's absolutely an important topic within the healthcare space. Well, let's look to the future a little bit, and think about like all the many moving parts that are happening within healthcare today. We've got digital experience we've been talking about, Gen AI, security, a whole raft of things that we could continue talking about. But what do you think the future of the patient or clinician experience is going to look like? Is it, going to become one unified approach that everyone enjoys? Is it going to be diversified beyond that? And what do you think healthcare leaders should be doing today to really get ready for the future that you envision?
I mean, I'll take the second part of that first, if you don't mind, if that's okay.
Sure. Yeah, please.
But you know, ultimately, what can be done currently is, I mean, there's a lot of different initiatives that can be launched, right? But the principles remain the same. If AI is a tool, it's a powerful tool, but that tool is only as powerful as its adoption. And so the principles of new technology adoption still remain. You've got to get out, you've got to talk to your clinicians, your staff, really start to understand where those friction points are. That's a good starting spot, right? There's training and support. You can start small. There's no reason to try to tackle this, try to boil the ocean all in one take. I mean, there are a lot of small data-driven initiatives that can push you in that right direction. And then, just kind of maintaining that continuous improvement attitude, philosophy throughout the entire thing. I honestly believe that data and tools like AI are going to fundamentally change the way that patients and providers interact.
Mm-hmm.
Yeah, I would second that, and I would say we've always known this, right? We've known that tools and adoption and things are top of mind and important, but I think with the shift in things, right? Like, I mean, even venture investment and startups in digital health, that's kind of slowed down, and we're kind of examining why, other than other market factors like, supply and cost of materials. We're seeing this shift to tools being put in the hands of employees and clinicians. So getting these other building blocks, the things that WWT focuses on, quite honestly, like the data, the infrastructure, the accessibility, the cloud, the security, is really important right now, because clearly what the market signaling is CIOs and their teams are being very strategic about what they're investing in. They have to be very intentional. They're getting a plethora of requests, which they really hadn't before because of things like Gen AI. So getting that foundation in place, which I think you alluded to, is key, and really making sure you have a sustainable and scalable plan as they kind of embark on this next era.
Yeah. All right, so last question for you two, right, to kind of sum up the conversation we've had today. I'm curious if you imagine we're talking to some healthcare leaders there out in the world, and we're giving them your top 3 tips or top 3 things to keep in mind relative to healthcare and where we're going with digital transformation. What are your top 3?
If I had to pick 3, I would say, start with the basics, data, cloud, security, getting that really pretty solid. I would say stronger partnerships. Tech can't be one department and lines of business the other. That's usually where we see a breakdown, to be honest. So let's get that, really kind of tightened up. And then I think with just where the budgets are and all the demand, I think really focusing on an ROI before, signing off on the next piece of technology that you're going to implement is going to be key.
Yeah.
How about you, Jeff? It's tough to narrow it to 3, but yeah, I mean engage your staff, your clinicians and staff, and really engage them to push toward adoption, because if it's not adopted, then it's not going to be effective overall. Number 2 would probably be start small. I mean, again, there's a lot of data-driven initiatives out there that can move you in the right direction. You don't have to boil the ocean overall. And I would say number 3 really is just kind of maintaining that consistent, continuous improvement type of philosophy as you move forward.
Excellent. Well, thank you both. It's been super fun having 2 experts with us here today, and I very much appreciate you joining us. Thanks for coming.
Thanks for having me.
Yeah, thanks for having us. Appreciate it.
Sure. And look, if you've enjoyed this episode, we've got 3 more in this 4-part series about healthcare. The other 3 around artificial intelligence, cloud, and security. And you can check those out and much, much more on WWT.com. We've got a whole events section of events coming up on the calendar. You can register for those. A back catalog of great episodes you can watch on demand at any time. So head to WWT.com/events and check that out. That's our show for today. Thanks for coming, and we'll see you next time.